Hello, you're welcome. Welcome to the teacher channel, and in this session, this session will be about practice questions, and this is episode number 2, meaning that there's already number 1. So if you have not watched the video on the first practice questions session, it would be a good idea if you do so. So remember that the main objective here is to give you an idea of how the final question may be. It's just like a feel. Also, for you to use this as a mock exam, use it to test your knowledge, what you have learned so far, or what you need to learn. Okay, so apart from using this to prepare for the exam that is to come, you also want to use it to measure how much you have learned so far. So again, take a piece of paper and then put down the answers to the following questions. There will be about 25 questions, and so we're going to review this in the class. So bring your answers with you. Okay, so are you ready for question number 1? If you are ready, okay, let us see that. So question number 1, which of the following modes can diseases be transmitted? So which of the following modes can diseases be transmitted through? A. Indirect contact. B. vector-borne. C. airborne. D. All the above. So which of the following? So if there are 2 or 3, you put their letters. So if you think the answer is B, C, D, just put B, C, D. If the answer is only 1, just put the letter. Okay, so which of the following modes can diseases be transmitted? Okay, A. Indirect contact. B. Vector-borne. C. Airborne. And D. All the above. Okay, so put your answer as we go to question number 2. Question number 2. Rule of nines is one of the techniques used to determine the percentage of body burned or percentage of the body affected by burn. Which another rule could be used? So rule of nines is used to determine the percentage of body burned. Which another rule could be used? A. Rule of 5. B. Percentage burnt rule. C. Rule of Palm. D. 9+ rule. So rule of 9 is used to determine the percentage of body affected by burn. Which other rule could be used to achieve the same? A. Rule of 5. B. Percentage burnt rule. C. Rule of Palm. And D. 9+ rule. Again, put the letter that matches the choice you have made for this question, and then let us go to question number 3. Question number 3. Which of first aids are proper for an unconscious? Which of the first aids are proper for an unconscious patient? Okay, which of the following first aid activities are proper for an unconscious patient? Okay. A. Put him in a recovery position. B. Start CPR immediately. C. Assess for normal breathing. D. None of the above. So which of these first aids do you think are proper or is proper for an unconscious patient? Okay. A. Put that patient in a recovery position. B. Start CPR immediately. C. Assess for normal breathing. D. None of the above. Okay, so put your answer and let us go to question number 4. Good Samaritan Act or law. A. Prevents first aider from being sued. B. Protects the patient from liabilities. C. Protect first aiders from liabilities. D. Both B and C. So Good Samaritan Law, Good Samaritan Act. A. Prevents first aider from being sued. B. Protects the patient from liabilities. C. Protects first aiders from liabilities. D. Both B and C. Okay, so what is your answer as we move to question number 5? Question number 5. A first aid certificate holder should renew his or her certificate within A. 4 years, B. 3 years, or as determined by his or her agency. C. 1 year. D. 5 years. So a first aid certificate holder should renew his or her certificate within 4 years, within 3 years, or as deemed necessary by his or her agency. C. 1 year. D. 5 years. So when do you renew your certificate if you are a first aid certificate holder? Okay, so we're moving to question number 6. To determine if a patient is in life-threatening conditions, the first aider must check the patient's A. Sugar level, B. Responsiveness, airway, breathing, circulation, D, B and C. So I read that again. To determine if a patient is in life-threatening conditions, the first aider must check the patient's sugar level, B. Responsiveness, airway, C. Breathing, circulation, D, B and C. So what do you think the first aider will need to check before determining if a patient is in a life-threatening condition? Okay, so we're moving to question number 7. Which of these should be done as first aids to a patient with a spinal cord injury? Which of these should be done as first aids to a patient with a spinal cord injury? A. Reposition him immediately. B. Avoid moving the patient unless necessary. C. Call the emergency number 911 immediately. D, B and C. So which of these should be done as first aids to a patient with a spinal cord injury? A. reposition him immediately. B. Avoid moving the patient unless necessary. Call that number C. Letter C. Call the emergency number 911 immediately. And D, B, and C. Question number A. CPR and AED have the same purposes. CPR and AED have the same purposes. A. True. B. False. CPR and AED have the same purposes. Is that true? If it is true, choose A. If it is not true, choose B. And then we move to question 9. Pale, cool, and clammy skin is a sign of which emergency? Pale, cool, and clammy skin is a sign of which emergency? A. Shock. B. Hyperglycemia. C. Stroke. D. None of the above. So pale, cool, and clammy skin is a sign of which emergency? A. Shock. B. Hyperglycemia. C. Stroke. And D. None of the above. Now we move to question number 10. A patient is unresponsive or unconscious but breathing normally and circulation seems okay. What position would you put the patient? A patient is unresponsive or unconscious but breathing normally and circulation seems okay. What position would you put the patient? A. Semi-sitting position. B. Recovery position. C. Tripod position. D. Prone position. So what is your choice for a patient that is unconscious but breathing normally? What position is preferred in this type of situation? So question 11 is coming. How would you say that a direct pressure applied to a wound is not too tight? How would you tell that, or how would you say or tell or confirm that a direct pressure applied to a wound is not too tight? Okay. A. Blood refills within 2 to 3 seconds. B. Patient admits numbness is present. C. Skin color and temperature appear normal. D. Only C is correct. E. A and C are correct. Okay, so how would you tell that a direct pressure on a wound is not too tight? So blood refills within 2 to 3 seconds. B. Patient admits numbness is present. C. Skin color and temperature appear normal. D. Only C is correct. E. A and C are correct. Okay, so we're moving to question number 12. Peter has just had a compound fracture of the ulna. How do you explain this type of fracture? Peter has just had a compound fracture of the ulna. Okay, how do you explain this type of fracture? A. It is the same as an open fracture. B. It is the same as a closed fracture. C. Bone hairs may be visible. D. A and C. So compound fracture, what is it? Is it the same as an open fracture? Is it the same as a closed fracture? Do you expect to see the bone sticking out? That is option C. Or do you think A and C are correct? Now we'll move to question 13. What first aid should be given to Peter with a compound fracture? What first aid should be given to Peter? Peter is a patient, and this patient has a compound fracture. A. Wash the injured area with lukewarm water. B. Apply a slight pressure on the injured area to stop bleeding. C. Cover the injured area carefully without direct pressure. D. None of the above. Okay, so what is your answer? What first aid is appropriate for a compound fracture? Do you wash the area with lukewarm water? Do you apply a slight pressure on the injured area because you want to stop bleeding? Do you cover the injured area carefully without direct pressure on it? Or do you think none of the above is correct? So make your choice, and let's move to question number 14. Miss B is actively having a tonic-clonic type of seizure. What should you do as a first aider? Miss B. So Miss B is the patient, and this patient is actively in seizure of type tonic-clonic. So what should you do as a first aider? A. Insert spoon into her mouth to prevent tongue biting. B. Restrain her from twitching on both legs. C. Protect her from injury. D. Call 911 and do not help unless directed by the EMS. Okay, so what is your choice? Is it A or B or C or D? Make your choice, and let us move to question 15. If you are ready, I'm ready. Let's go for question 15. Alright, so 30 and 2 times n is an expression indicating that cycles of CPR should continue unknown number of times. So 30 compressions, 2 breaths should continue n time, and n is unknown. What should the first aider, when should the first aider stop? When should the first aider stop performing CPR? A. If patient begins to breathe normally. B. If EMS arrives and takes over. C. If the first aider becomes too exhausted to continue. D. All the above. So what are the stopping conditions for performing CPR? Okay, so we're moving to question number 16. Pushing hard and fast at the center of the patient's chest is important for. Pushing hard and fast at the center of the patient's chest is important for A. Adult patient. B. Infant patient. C. Child patient. D. All the above. Pushing hard. Remember that when you perform CPR, one of the most important attributes of high quality CPR is that you're going to push hard and fast at the center of the patient's chest. So when do you, who does that apply to? A patient, an adult. B, an infant. C, child. D, all the above. Number 17. What is the rate of chest compressions on an infant patient? What is the rate of chest compression on an infant patient? A, 60 to 100 compressions per minute. B, the same as for an adult or child patient. C, 100 to 120 compressions in 60 seconds. D, both B and C. Okay, so rate of chest compression in an infant. What is it? So make your choice, and then let's move to next question, number 18. Why is AED important during resuscitation attempt? Why is AED important during resuscitation attempt? A, it pumps the blood more effectively. B, it restores the normal heartbeat or rhythms. C, it doubles or triples a patient's chance of survival. D, B, and C. So why do we need AED as soon as possible when somebody is in cardiac arrest? A, it pumps the blood more effectively. B, it restores the normal heartbeats or rhythms. C, it doubles or triples a patient's chance of survival. D, B, and C. Now we move to the next question, 19. Okay. You have decided to provide first aid to Tom, who seems to be in need. What should you do first? A, assess Tom for agonal breathing. B, check for safety and think about your protection. C, stop the bleeding immediately to avoid the shock. D, check Tom's RABC. Okay. So what do you do first? What do you do first are the emergency scene, and Tom is the patient. You have decided to help. So what do you do first? Assess Tom for agonal breathing, check for safety, and think about your protection. Stop the bleeding immediately to avoid the shock. And D, check Tom's RABC. So question 20. Angina should be treated with the same sense of urgency as heart attack. Angina should be treated with the same sense of urgency as heart attack. A, I disagree. B, I agree. C, not necessarily true. D, or the above. So angina should be treated with the same sense of urgency as heart attack. A, I disagree. B, I agree. C, not necessarily true. And D, or the above. So what's your answer? Question 21. A patient has too much insulin in the bloodstream but does not have enough sugar. What emergency may the patient be into? A patient has too much insulin in the bloodstream but does not have enough sugar. What emergency may the patient be into? A, underglycemia. B, hyperglycemia. C, hypoglycemia. D, none of the above. So a patient has too much insulin in the bloodstream but does not have enough sugar. What is the name of the emergency that this patient may be into? Underglycemia. B, hyperglycemia. C, hypoglycemia. D, none of the above. So question number 22 is on the way. Mr. J is in an anaphylactic shock due to severe allergic reaction. Okay, Mr. J is in an anaphylactic shock as a result of severe allergic reaction. What medication do you think he needs now? A. Benadryl, B. EpiPen, C. epinephrine, D. Any of the above. Okay. Anaphylactic shock, what is medication needed in this type of emergency? A. Benadryl, B. EpiPen, C. epinephrine, D. Any of the above. We're moving to question number 23. Tripod position is the best position for a patient A. who is half dead, B. who is having problem with breathing, C. unconscious but breathing well, D. none of the above. Tripod position is the best for a patient A. who is half dead, B. who is having problem with breathing, C. unconscious but breathing well, D. none of the above. And then we have two more questions to go. Question number 24 is coming. Vinegar could be used for in what emergency? Vinegar could be used for in what emergency? A. complete amputation, B. nosebleed, C. jellyfish sting, D. both A and C. Vinegar could be used for in what emergency? A. complete amputation, B. nosebleed, C. jellyfish sting, and D. both A and C. What do you think is the answer to that question? And then I think the last question is coming now. Question 25, the last. Baby K starts coughing spontaneously when eating or while eating. You conclude that she is choking. What will you do next? So baby K starts coughing spontaneously, loudly while eating. You conclude that she is choking. What will you do next? A. Give her 5 back blows and 5 chest thrusts. B. Encourage coughing while monitoring her ABCs. C. Call 911 immediately. D. Don't do anything. So what type of first aid do you give to this baby that is eating and then coughing spontaneously, and your conclusion is that she's choking? A. Give her 5 back blows and 5 chest thrusts. B. Encourage coughing while monitoring her ABCs. C. Call 911 immediately. And D. Don't do anything. So I think you have come to the end of the practice question. Oh, no, there's one more. Okay, question 26. Okay, to be protected by Good Samaritan Act or law, the first aider must. Okay, to be protected by the Good Samaritan law or act, the first aider must A. use reasonable skills, B. stay within the scope of the first aider or first aid, give medication with adequate carefulness. So use reasonable service, stay within the scope of first aid. That should be first aid, not the first aider. And D. C is give medication with adequate carefulness, and D is A and B. What do you think is correct? Okay. Alright, so thank you so much. You have come to the end of the practice question. I hope you enjoyed it. I hope you have now assessed yourself and know how confident you are for the final exams. You don't have to worry so much because we're going to go through this, and I want you to use this also to guide you in preparing for the exam. Alright, thank you, and if you have not subscribed, okay, please do so. I also want you to like the video. Okay, thank you so much, and I will see you again in my next video. Bye.